Hi everyone, Dr. Palvia here again. Today I want to talk to you about something that I'm doing a lot when I'm not here, and that's anesthesia. So I just wanted to sort of give a basic overview about anesthetic terms. Maybe I can go in more detail in future videos. But basically today I wanted to sort of clarify the differences between the different kinds of anesthesia that are out there, maybe clarify some of the terms that you might hear. When I think of anesthesia, I think of basically 3 to 4 different kinds of anesthesia, and I want to take you through those. So let's begin with local anesthesia. Local anesthesia is basically a very focused point of anesthesia. Anesthesia is a Greek for basically removal of pain, and so the purpose of local anesthesia is to remove pain in a very focused area of the body that is undergoing surgery. These are typically for minor procedures, even dental work. A lot of times the dentist will say, let's do a shot of Novocaine. Novocaine is basically a local anesthetic that is infiltrated in the site that they're working on. So that could be in the gums or for oral surgery purposes. A lot of times we do local anesthesia in the office as well. So a lot of office-based anesthesia is local. And basically that involves an injection of lidocaine in the surgical field. Lidocaine or a longer-acting anesthetic like bupivacaine. All these terms describe local anesthetics used for minor procedures. The next one is peripheral anesthesia or regional anesthesia. So basically this is also a localized type of anesthesia, but for a much larger body part. Typically it's used for extremities, although there are other purposes. But for extremities, so things like orthopedic surgeries, basically the anesthesiologist will apply an anesthetic to a bundle of nerves or a major neural structure, typically done with an ultrasound, sometimes done with X-ray. And the purpose here is to deposit a large amount of local anesthetic over a bundle of nerves. So for example, the shoulder surgeries typically require anesthesia in a large area, but still localized, so right here. So a lot of times the anesthesiologist will look for a bundle of nerves called the brachial plexus that basically supplies the shoulder. And if the anesthesiologist using an ultrasound can catch those nerves basically higher up and deposit anesthetic here, then this entire area can become numb enough for surgery. The benefit of this is basically general anesthesia, which I'm going to talk about. You can administer less of it or even get away with not using general anesthesia at all, which can be a benefit, especially in those folks who may be more susceptible to the problems with anesthesia. And also it's great for pain control because a lot of times those anesthetics can be prolonged in their duration of action. And so even after the surgery for pain control, it can be very good because that area basically remains minimized with respect to pain. This is good for avoiding any medications you might have to take orally, which could cause systemic side effects. There are kinds of side effects with medications. And so that's why peripheral anesthesia or regional anesthesia can be very useful. Also very common for knee surgeries. There's some lower extremity regional anesthesia you can do. A similar concept to regional anesthesia is neuraxial anesthesia, which is basically applying anesthesia to the spine. And so that is a lot of times you may have heard of an epidural treatment that's basically used for labor or providing pain relief without having to knock the patient out. Of course, that's very useful in things like labor where you cannot knock out the patient. But you can still get great pain relief using these techniques. General anesthesia, basically, this is the most intense form of anesthesia and basically entails a full loss of consciousness. And the purpose of that is that you basically are trying to remove any perception of pain whatsoever due to the complexity of the surgery. So now we're talking more major procedures, any internal organs or any intra-abdominal, intrathoracic surgery, brain surgeries, heart surgeries, or even a surgery that might be complicated. You may not be able to just anesthetize a local part of the body or even a regional part of the body. So these sorts of procedures would require general anesthesia. So that's more of an inpatient or operating room in a surgery center kind of situation. A lot of times in those cases, we're trying to get full loss of consciousness, full removal of pain perception, full muscle relaxation so that the surgical field is optimized. So a lot of times that requires assistance with breathing and ventilation. So Now you're talking about a much more complex form of anesthesia called general anesthesia. Related to that, you may have heard of IV sedation. So that's another term that's used a lot. General anesthesia can be induced by either using an IV, which is intravenous, or it can be used. It can be accomplished with inhalational, which basically means using a gas that's delivered to the lungs that can induce that state, general anesthesia state. So IV sedation basically is using just intravenous to achieve a level of anesthesia that's desired, whether it's general, which means total loss of consciousness, but also if it's just a light level is required for maybe procedures that still require relaxation and loss of consciousness, but only briefly. So for example, procedures like a colonoscopy or perhaps some kind of outpatient procedure, cystoscopy, whatever it is, a lot of times you can just do IV sedation. A lot of times I've also heard terms like twilight. Similar concept. Twilight is not really a medical term. That's just more of sort of a colloquial way of saying IV sedation, which means not general anesthesia, but not locally. There's some level of loss of consciousness is required. So I hope that helped clarify things. That's it for this one, guys. I hope you found it informative. Please send me a question or drop a comment below. I'll see you in the next one. Thanks.